To begin this protocol, I use a curvilinear array. I make sure that the setting for the probe is set for, right there I click probe, I set it for abdomen, and then I make sure to unfreeze it, make sure the setting is correct. So abdomen, I'll click that there, and then I should be all set to go. The knobs there will help me identify up there that it's correct. I make sure that the patient is laying down, and then I cover the room so that there's privacy and she feels comfortable. I also cover the patient with some paper towels so that the gel does not get on her. Once she's ready, I grab the linear probe and start using a bit of the gel. I spread it around just so I can make sure there's gel all over where I'm going to be scanning. This is the liver. I use color flow on it just to see the flow of the color. There is the gallbladder and a bit more of the liver as I'm scanning. There are two different directions. So the first direction is sagittal direction, going up and down. The probe will be facing up, the notch, and then trans with the probe, the notch facing you.